Hello, everybody. Very happy to have all of you here for the SPX TALKS, the third session. So we're very happy today to welcome Olga Kokshagina, who will speak about women's health and women's experience, we could say it, as patients. We're Daniel, and together we organize these sessions each time, and today again. So we'll moderate the session together and we'll share some information with you. So today, welcome Olga, very happy to have you with us. You're an engineer in technology, but maybe I'll let you introduce you better after me. And you're very interested in women's health. You did a lot about it. You founded an app. You will tell us about it later. And you wrote a book, a white book, where you give pieces of advice about how to take care of women's health, especially in companies. So we're happy to have you today. And maybe the first thing is to introduce yourself and to let us know how you wanted to be interested in women's health.
Thank you, Celine, Daniel. Thank you for organizing these talks, and thanks for inviting Ninti to be part of Tech Talks organized by SPX. So just to briefly introduce myself, so Olga Kokshagina, I am a founder of Ninti. So we founded a company with Fatumata Lee almost 4 years ago now. And our somehow challenge was to say, okay, there is a lot happening in women's health, but how do we actually bring those subjects to companies, to businesses in the first place? And why did I end up in that? As Celine asked me, why women's health? So in a way, coming from an engineering and tech background, I always worked in innovation and technology and trying to see how digital technologies, AI in general, can actually support different topics in different areas. And healthcare was something that was very dear to me. So I started working on cancer epidemiology, trying to use big data. We had a project with Roche and Lafayette a few years ago, and then also worked on strategy building in Australia, actually with abortion and fertility clinics, 2 different projects. And somehow it opened up the world where there is still a lot of taboo, a lot of stigma, the need for conversations. And we started thinking, how can we actually support people? How can we work with healthcare practitioners to actually structure pathways to better support women and different conditions that are related to them? So this is the beginning. Over to you.
Okay, and one question is, it's difficult to make the difference between patient experience as a woman and woman experience. So here we are, as in shared patient experience, we focused on women's health and patient experience. So how do you consider the board between women's life, we could say, and women as patients' experience?
I think it is very hard in a way, and there is no one size fits all in general when it comes to women's health. That's why we talk about holistic healthcare. And it's up to us somehow. I think it's the same with every condition to distinguish what do we want to integrate in our care practices. Should be medical, should be emotional support. What do we integrate within the holistic support, and how do we identify services that will actually help us have better quality of life, have support that we need in different times and conditions. Already women's health, it's very broad. When we talk about women's health, especially in the business environments, it's pretty much how do we support professional women navigating different conditions, which can be menstrual pain, it can be infertility issues, it can be postpartum. How do we support parental leaves, for example, for both women and allies and men who support them, of course, families, but also perimenopause and menopause. And the numbers are very interesting. I mean, 1 in 6 couples going for fertility actually have issues today. 90% of women who will go through the IVF treatment have issues related to mental health. 1/3 of our lives we live in menopause, and I can continue. 1 in 4 pregnancies end up in miscarriages. So there is a lot that can be done. And when I go back to your question, question in a way. We need ourselves to be aware what's happening. So for me, the big part is awareness to actually better understand why certain things affect me, which type of support is available in my company, but also elsewhere that I can use, and how do I adjust whatever I need at that specific moment, and which care I integrate, whether it's holistic care, whether it's mental health, whether it's emotional support, and yeah. So no one size fits all.
So these three fields, you work on it. And if we go deeper on this topic, how do you help women? What do? You founded a company which provides an app. You did a lot about it. What can we do? What do you do about it?
Essentially, even very simple things. So today we have 3 activities. So first is really awareness and trying to bring the right information at the right time, because we see that sometimes we don't know where to find the right information, apart from maybe searching for Google. Sometimes it's hard to identify the right practitioner specialized in your condition. So information available through the platforms, available through the companies that we work with, through webinars, conferences with healthcare practitioners. Support essentially for those who are ready to take action, who know exactly how to go through different conditions. So we have an integrated care practitioners that will guide people on the platform to actually identify support that they need. Sometimes it's the second opinion, sometimes it's the specific conditions like endometriosis, sometimes it's trying to identify a specific fertility clinic that will help a certain patient to go through the experience. And one other essential part that we see a big need for is the community. Sometimes it's just understanding that you are not alone navigating those conditions, is actually identifying and talking to care practitioners, but also to other women navigating for similar things. So community, support, and awareness, essentially 3 elements that we provide today.
So you consider that improving patient experience in this field again is to help to access to the information, the first step, to get support from the community, and to know how to better manage patient pathway or women pathway through healthcare professionals, through facilities, and so on. Can we say that it's the 3 axes you work on?
Definitely, and help us by going through all of that, see that we're not alone. Also, our healthcare, once we try to bring those topics in the workplace, it's also not sometimes very natural. It depends on the organizational culture in place. Even myself, I've been in the work environment where it's not easy to talk about those things. And it doesn't mean that you have to. It feels like every person should have a choice whether we bring those topics in the workplace or not, but also feeling that we are supported by our employees while going through those treatments. Why? Because there is a lot of stress. It takes sometimes a lot of time. Sometimes it's time from work. So how do we accommodate those things? And that essentially also impacts somehow the patient experience going through, for example, fertility treatments. How do we imagine the workplace that can support and better accommodate those elements? And of course, in Europe, especially in countries like France, we have more and more legislative support to help you take the time off to actually accommodate those needs. Yet, when we look into the numbers, using those type of support mechanisms also still not very systematic, and not many companies are aware how they can better support their employees and patients going through those elements. Yeah.
And do you have to work with companies? Do you work with companies how do you work with companies to improve women's experience, we could say?
Actually, people can access resources directly through Ninti, and many resources are available for free, especially when it comes to creating awareness. When it comes to companies, there are 2 elements. So one is pretty much this awareness building. Many companies today are still building awareness. They are willing to help their employees going through these conditions. Also, to have, of course, better mental health at work, but it's also related to issues like productivity, performance, absenteeism at work. We know that every dollar invested in employee benefits programs actually create at least $4 return investments. So there are also reasons behind, and this is decided on by the World Health Organization years ago. Companies are trying to see how can we better integrate and better accommodate the needs of our employees, because if you look into the numbers, a lot of people actually leave their jobs once they start having kids or they're going through different conditions. So creating awareness by companies trying to identify what are the needs of our collaborators at work through different webinars, sometimes conferences. Just a month ago, we did a conference in a big company here in the Russia enterprise here in France on endometriosis, for example, bringing healthcare professionals, trying to see who shows up, which type of questions, how we can better support employees. And then after that, it's really providing support. So employers more and more provide through benefits, through private insurances. They allow access to their employees for platforms like Ninti to actually go and work around different conditions that are needed for them.
So you help them to organize meetings and to give information to women, so that everyone in the company, including men and other women, are aware of what's happening with the women, what are the needs, and so on. That's it.
Yeah, and exactly. And there are more and more men actually also joining those sessions because perhaps they've experienced something similar with their partners, or managers who would like to know more. How can we better support our employees when it comes to different conditions that they would go through? For example, with a big tech company, last year we had a big project on training global ambassadors. So it's an international company. They have different offices, so different legislations as well affecting support of women's health. So what they wanted to do is to create a task force within the company to actually identify what do we have available, how do we better support employees, which type of digital support we can use. So essentially we worked with for several months with ambassadors of that basically who applied to become ambassadors for fertility in this case, in that company, to actually better integrate different practices, and we still continue working with them. So pretty much creating awareness, creating task force, so employees know who are the referees they can go talk to better understand how they can be supported as well.
They are to pay for it. Companies pay for it because they think it's important for them.
Exactly. And when you look into the numbers, especially the ones that we mentioned on productivity, absenteeism, the cost even of recruiting and losing employees, it becomes obvious to them that, okay, we actually need to do something. The question is, what is the right thing to do in our company, given the culture that we have, given the needs, even the average age of the employees and collaborators as well.
So you think the digital tools are very important for it? It's an important means that you use to achieve your goal?
To some extent, yes. I mean, digital does not, to be very clear, solve everything. Of course, it's just a tool. All depends how do we design the support, how do we structure the pathways that are supported by digital to provide better access to information, to verified information, as we said. How do we connect people, perhaps living in different geographical areas? We know more and more, for example, again, I'm bringing numbers about France, but we have more and more medical deserts where if you live in the regional areas where when you work remotely, it's very hard to identify a good professional. The waiting times are becoming longer and longer. So having the second opinion through platforms like Ninti, through other solutions, we can reduce this waiting time, at least to get the first opinion, to be able to identify, for example, a professional who is specialized in endometriosis, because not every gynecologist will be, for example, be able to be specialized and be able to recognize the early diagnostics and early symptoms of that. And for that, digital, I think, definitely reduces the barriers for that. It also helps us maybe have a better follow-up, better tracking of our symptoms. We can better connect to other, as well, the aspect of community, other users, patients going through the same issues and be able to discuss with them on a continuous basis. For example, one of the features we see being used quite a lot is also structured FAQs. We realize that we often have similar questions. So basically, by bringing those questions together in a systematic way helps us save time to better prepare for a doctoral appointment, to be able to be better followed by the care practitioners and integrated care practitioners to basically guide them through what specialized care do I need at that specific moment.
And last question, did you evaluate what you do? How many people, what results? How did you measure quality of life? Because we spoke about it previously. What results?
We are trying to continuously improve how we do that. Obviously, when it comes to patient experience, we talk about outcomes measures, experience measures for different users going for different treatments. In this case, we try to have measures for companies, but also for the users going for that. What's important, we do not share. For example, if the company provides access to their employees for to support them going through different conditions, they would not know exactly who is going for that, for which type of treatment. They will have the numbers of how the users engage, which type of topics they look into, so they can better see what are the needs, but they would not know exactly, due to privacy concerns, of course, how and which type of doctors and a specific user went through. So we try to see the usage, the retention rates for the patients itself. It's pretty much, okay, are there any outcome factors that we want to see? We're still very early, so we're trying to structure all these elements, and we are always trying to see what's the experience. And we try to measure it quantitatively through factors like NPS and Net Presenter score, satisfaction of using different services, but also qualitative measures. So how did it help you? What can be improved? We often do focus groups with different users that go through our solutions, who participate to our webinars, to actually see what is missing. How can we support their needs better? What else needs to be accommodated? And what are also the elements that they would not want to share, for example, with their employer? What digital console, for example, how do we create this physical, digital experience to some extent by leveraging also the support of different women's clinics that we have as well.
But you don't have result at this moment on how patient experience or women's experience, we could say, improves with this organization and this tool.
I have qualitative measure, like basically, yeah. I'm not going to tell you 8 of 10, but in a way we collect qualitative information. And today what we see is pretty much having a second opinion, having better access. So for many who would actually try to structure their fertility treatments, people feel lost. So having everything in the same place, being able to be referred to different practitioners, that's another time saver for many who work in the companies. The other part is really what we see a lot is this feeling of being heard, of having other people going through that and be able to find your peers who will actually help you support through their own experiences. That's what we see a lot that comes up in all the feedback forms of people who use our services.
From the companies you work with, what do they say?
The companies today, it's quite interesting because we see a lot of companies who come to us and they were like, okay, we know that it's a topic, but we don't know what we can do. So it's very early for some. And for example, we had a big international company as well that was surprised by the number of people who actually subscribed and came to the meeting. So we had 250 people who subscribed to a Zoom webinar that we did with them, and 200 actually showed up. And for them, it was like, wow, it's a topic. We didn't actually know that there's so many people trying to see how to better position what's happening, how do we organize ourselves better. So for many, it's actually identifying systematically what are the needs of our employees and how we can better support them, seeing that it's not such a taboo topic and people are actually interested to see how their own employer can better support them when they go through different issues like mostly fertility in our case, parental, basically postpartum miscarriages, and then menopause as well.
Thank you.
But still, there is a lot to do in terms of maybe also challenges as well. A lot to do in terms of, okay, we're creating the awareness, but what role businesses should play in systematically supporting women's health? I think we also need to see how do we fund and how do we finance, and who has the responsibility to pay with the increasing costs when it comes to managing chronic conditions and comorbidities as well, which is not easy.
Thank you very much. Time for questions. Does someone have questions for Olga? First one, what kind of digital tools do you use for that? For what purposes? How do you track symptoms, and what do you do with those data? Education, referral to doctor when needed. Many questions in one.
Yeah, thank you, Anouk. So digital tools, I mean, we develop our own. Obviously, we also work with lots of people in the ecosystem. For example, for tracking, you have lots of apps that will help you with menstrual tracking. For the education, I mean, we ourselves develop a lot of content. We also leverage contact of other providers. I will not name specific apps, but if you have specific questions, reach out to me. I'll send you the list to avoid the promotion. And basically, so you have a lot of things that support you with tracking symptoms, lots of apps to help you with education, things that will help you to create your own community. For example, we ourselves, we have circles that prove to be quite interesting. So people join a specific circle of people going through different conditions to actually connect with them once a week, for example, to learn more. Referral to doctors as well. So as we mentioned, having a second opinion, we have a kind of annuaire in a way of many practitioners that you can refer to. Another great, for example, for example, there is an application that works with clinics like APHP here in France that help you develop protocols and follow specific protocols when it comes to going through for fertility treatments. So doctors will communicate to you through specific devices. There is a lot of AI support, more and more. We haven't talked about AI today on basically optimizing different treatments, basically having a virtual assistant. So that's a solution that we are also testing right now, basically having a support system that help you answer your basic questions and then refer you to specific care practitioners as well within the platform. So a lot of them out there, lots of different bricks, and I'm happy to give you more specific examples as well if you want to. Yeah.
Thank you. Another question? What I find interesting, Olga, is again, I said it at the beginning, the broad between women's, we are half of the population, women's well-being and women as patient well-being. And it's very hard to know how do we need a broad? I'm not sure. It's a question when you are a professional in healthcare. You wonder, at which moment you have to help women or not, and how we can do. And it's an important question regarding of our goal here about patients. But maybe we can say that each woman will be a patient one day. It seems that you said it, or how do you say it?
It might be yes, it might be no. There are many, women that we work with, and we do lots of co-design activities to actually understand the needs and try to iterate every time what we do to better support patient needs. Not everyone will be a patient. Not everyone will see herself or himself as a patient as well. Like, for example, a lot of people, myself, I have an endometriosis, for example, but I do not want to be associated with that illness. So you will yourself that frontier, are you a patient or not? It really depends on the symptoms you are having, on the support that you need. That's why there is no one size fits all to some extent. It's really how do we create customized pathways that will help to support each specific patient or a woman having specific needs at the specific life stage. So that's why having these diagnostics at the very beginning help us identify what are the needs and then test, okay, so perhaps that type of support is available. You can use that. Perhaps you can change it. And why it is needed is, yes, there are certain conditions for which we have treatments. Then there are others for which it's pretty much a life change. Things like PCOS, things like endometriosis, many other aspects related to women's health, there are no treatments available. So it's more, how do we support different patients through basically behavioral changes, through nutrition, through emotional support, through sports, perhaps hormonal treatments as well, but we need to test based on the needs of what works for a certain patient, what doesn't, and how do we accommodate that. That's why it's hard to answer that question, and we need to adjust it to specific needs of specific people. And some of them might be like many women, senior women in management we talk to, they tell us, look, I have several kids, I never had issues, so why do we need to focus on that? And that's great, but there are many, and when you look into the numbers of 1 in 10 people having endometriosis, 1 in 4 people having a miscarriage, 1/3 of our lives living in menopause again. I mean, it starts to be a very big market in a way.
You're right. It's very interesting to see companies going deeper in healthcare. For instance, we see the same in oncology, where companies are very interested in how to help their employees to come back in the companies after chemotherapy or something like this. So very interesting to see it. So thank you. Yeah. I'm not sure you have another questions, but maybe Daniel has some announcements to do. And thank you, Daniel, again. But share patient experience. Yes.
Thanks a lot, Céline. Thank you, Olga. So overall about SPX, so a few news. So there are 2 upcoming SPX talks which I encourage you to join to. One of February 5th, which will be in French, so it will rather be for our French-speaking colleagues, which will be with an emergency physician, which is working at Hôpital Foch, and who is using digital to optimize the fluidity of patient process in emergency care. At the same time, meaning 1 week later on February 12th, it will be an SPX talk in Spanish, so for our Spanish colleagues, with Alexandra Carpentier, who is heading patient experience program at the Josep Carreras Foundation, and who will talk about especially young people and the leukemia. And last but not least, on behalf of Nathalie Delbracin, so about the awards ceremony of SPX. So I remind you that it will take place on April 10th in Belgium, in Groupe Santé CHC in Liège, and you can register to participate to the awards ceremony, which will be a great one. If you think a bit at the Oscar in the cinema, we are aiming to do the same. So I encourage you to come. Thank you.
Thank you, Daniel. Thank you, everybody. I think we are at the end of the station. You can find some links here on the chat box where we can find the page to Ninti, the app we spoke about before, and the white book we spoke about too, about women's health. And thank you again, Olga. For your time and for all the interesting information, and you'll find everything on replay in a few days on our website and on YouTube. So thank you again, everybody, and don't forget to come to SPX, which is a very, very interesting association, and we are involved in it, Daniel and I. So we support this association, and we encourage you to support it too. So see you soon. Thank you again, everybody.